Wellness for Life is brought to you by Perm Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.
Hi, I'm Dr. Mark Wheaton, owner and physician of Lakeside Sports and Pain Clinic. Clinic locations in Monaga and in Excelsior, Minnesota. And I run this clinic to offer alternatives to the standard mainstream medical care of surgery and drugs. And in so doing, we offer treatments such as prolotherapy and PRP, which is platelet-rich plasma. And our entire focus is to try to diagnose and correct injuries to the back, neck, and peripheral joints, and to eliminate chronic pain. I've been in practice for more than 20 years and discovered that some of the alternative treatments that have been around for a long time can provide the healing and repair that is necessary for a body to recover. In so doing, I have found out that through personal experience with my own treatment and through the patients that over the years that many injuries and chronic problems and pain can be resolved simply by taking the body's own machinery and stimulating it to repair itself. So what we'd like to do today is to look at a patient that has some chronic injuries and chronic pain, and then see if we can develop a plan that would help this patient. Today we're going to see a patient with a twofold problem. She's complaining of pain in her ankle and foot, and she does have some structural issues there that involve ligaments. But there's also a second component that could be influencing her problem. And so today we're going to look at her back as a possible referral source. So I'm going to ask the patient to do a few things by way of physical examination. Let's start out by having you reach down to touch your toes, and then come back up, and then extend your back backwards, and do a simple rotation left and right. Okay, that's good. Okay, then we're going to have the patient get onto the table, and then I'll examine her back. Okay, this patient is now in a prone position, and I'm going to examine her back, and we call that lower area the lumbar region, and there's a lot of ligaments there. Now the back is a very important structure, and I can assess a lot of the problems just by simple palpation, which really is just the use of my thumb to compress the tissues and to feel the texture and whether there's any tenderness that the patient is reproducing. So I go down to the patient's back and I begin to feel the locations where I might expect the pain to be. And so I'm right in the spine right there. And then if I move a little bit off to the side, I can then palpate the tissues corresponding to some of the muscles, the paraspinal muscles, as well as some of the ligaments, the iliolumbar ligament being an important one. And then as I come down here, the sacroiliac ligaments that reside in this region. So as I'm doing this, the patient oftentimes will say, yes, that's where it hurts, and I'm not putting much pressure on because this is for sake of demonstration. But as I do this, I want to assess the patient to find out where the sites of weakness and injury are, so that if this were to be an important source of pain in her leg, as well as weakness in her back, it could take care of both problems. Okay, and what I want to direct your attention to now is a diagram of the lower back or the lumbar region. As we see here, there's no muscle or any other fascial tissues covering the skeleton. The only thing that you see outside of the bones, the wing bones or the ilia, are the structures that I'm focusing in and keying on here are these fibrous tissues and connections between the bones. They are called ligaments, and they are what hold the body together. So the body is held together in such a way that that when it's held with a great deal of stability, that the muscles can operate in a normal fashion. But when these ligament tissues get stretched, wherever they may be, and that's often discovered when I press and palpate, and that reproduces pain. What happens is the muscles overlying these tissues begin to go into spasm, and it's quite painful. So the problem is not necessarily in the muscles, it is actually in the tissues of the ligaments. And when the ligaments are then strengthened by the process that is known as prolotherapy, then the process will result in a permanent stabilization improvement that the body then can function more normally without pain. Okay, so what I have here is the patient lying face down again, and I am just taking a pen to indicate where the spinous processes are in the lower back. And that gives me an initial plumb line as to where I need to start. And then from there, I will feel with my thumb to find out where the ilium, or where the bones that are on the side, the wing bones are. And so then I will draw a mark here as it curves, such as that, and the same thing over here in such a fashion. So now I know where my landmarks are, and the ligaments that I'm going to be injecting come right through like this and through like this. And then there are more ligaments than that, but that's one of the key ligaments, iliolumbar ligaments. And then I will then inject in this area and along the spine in this area. And so as I do that, I will have covered all the ligaments that you saw on that chart, and in doing so, it'll start a healing process that will last many, many months, if not longer, when it's done several times. So this is a process of growth. This is not a cortisone shot where one is going to get temporary relief, but it's all for the process of helping a person stimulate their own body's ability to heal itself. And in so doing, you grow new ligaments. So ligaments you grow are ligaments you keep. And so this is a process that is long-term, and we would hope that in the case of this patient and others like her, that this would not only stabilize her back, but also help the pain that is going down into her leg. So if you'd like to find out more about Lakeside Sports and Pain Clinic and what prolotherapy could do for you, please don't hesitate to call us at 952-593-0500 or find us on our website at drmarkwheaton.com.
Thank you for watching Wellness for Life. Brought to you by Perm Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.